Did you introduce yourself? Did you introduce yourself? It's recorded. Alright. Hi, my name is Stefan, and today I will be doing a general medical examination on my patient here, Aaron. So to start, we will be measuring respiration rate and pulse simultaneously. When performing this, you do not want to let the patient obviously know you are measuring their respiration rate because that could give you an inaccurate result. So to start, we'll locate the radial pulse, which is on the thumb side of the hand, and then I will have that arm across his chest, and then as the chest rises and falls, I'll be counting the respiration rate. And this you'll do for about 30 seconds, times that by 2 to get beats per minute and then pulse rate per minute. So Aaron has a pulse rate of about 74 and respiration rate about 14. So for respiration rate, 12 to 20 is normal, and pulse rate should be between 60 and 100. Anything above or below 60 or 100 could be signs of bradycardia or tachycardia, and then respiration rates will be abnormal if they're over 20 or below 12. The next component of the exam will be taking blood pressure. So when taking blood pressure, your patient should be in a chair with back support, have their legs uncrossed and feet planted on the ground. And then when applying the blood pressure cuff, you want to have the artery marker right above the brachial artery, about 2 to 3 centimeters. And then make sure the cuff fits on snug. And then to find the brachial pulse, for most people it will be just medial to the biceps tendon, so right here on the inside. And then when assessing or measuring blood pressure, you want to inflate the cuff to about 180 and then start to begin releasing the air. So Aaron has a blood pressure of about 118 over 74, which is within normal limits. Normal blood pressure would be about 120 over 80. Any number significantly higher or lower above that would be signs of prehypertension, potentially hypertensive blood pressure, or hypotension. The next component of the exam will be assessing temperature, which we will use an electronic reader to do so. So with this, we will be putting a new cover over the probe for sanitary purposes. And then instruct the patient to put the probe underneath their tongue for an accurate reading. And then once the machine beeps, then you know that you have a temperature. So for Aaron, this will be 99 degrees Fahrenheit, which is within normal limits, and a normal body temperature, internal body temperature, will be about 98.6. The next component of the exam will be palpating lymph nodes. So with this, you want to, when palpating the lymph nodes, you want to use the 4 fingers, not your thumb, and palpate bilaterally at the same time to check for any, for bilateral symmetry, or if there's any abnormalities, then you can determine whether that's on the left or right side. So the first set of lymph nodes that you palpate will be along the sternocleidomastoid, which will be right here. And so you'll palpate up along the sternocleidomastoid, and then right behind the jawline we'll be able to palpate the tonsillar lymph nodes, and then going down there will be the submandibular, and then right underneath the chin we will feel the submental lymph node, and then just behind posterior to the sternocleidomastoid muscle we'll have the posterior cervical lymph nodes, and then just above the clavicle we'll have the supraclavicular lymph nodes. And if there's any tenderness when palpating the lymph nodes, that could be indicative of some kind of infection because the lymph nodes are inflamed. Next will be the ear examination. So we will use the otoscope to look into the middle ear. And then always make sure you're using a new tip to ensure that it is sanitary for the patients. And so when examining the ear, you want to first look on the outside of the ear, noting any abnormal bumps, or if there's any discharge, or if there's any patches of skin that are different color. That could be signs of any kind of melanoma or skin cancer. And so when looking into the middle ear, you want to pull up and back on the ear, and then have a pencil-like grip with the otoscope. And then when you're assessing the ear, have the otoscope in your left hand to examine the left ear, and vice versa for the right. And when you're looking in the ear, you want to notice any, the cerumen, which if there is a significant amount, there will be impaction, which could cause a decrease in hearing. If there's any redness or swelling, that could be signs of an infection. The tympanic membrane should be a gray color when it is normal or healthy. If it's red, or if there's any effusions or tympanosclerosis, which will be a hardening of the tympanic membrane, that will also cause a decrease in hearing, and those are some red flags you want to watch out for. The next part will be a continuation of the ear exam with the Weber's test, and this one will be using a tuning fork. So for this, what you're going to instruct the patient is ask them if they hear the sound equally on both the left and right ear. So to begin this test, you will strike the tuning fork, place it on the posterior aspect of their head. Aaron, do you hear that equally on both sides?
Yep.
So this would be a positive test to show that there is no conductive deficits or sensory neural deficits in Aaron's hearing. But if there were, then you would follow up with a Rennie's test to confirm those findings. So for the Rennie's test, as usual, strike the tuning fork, place it on the posterior aspect on the mastoid bone behind the ear, and you would do this for just a second, and then move the tuning fork parallel to the ear for the air conduction, and then you would ask the patient if they hear this louder in the back when you're placing on the bone, or parallel. And you'll do this on both sides. And then where is it loudest? Okay. So if they have better hearing, or they can hear the stimulus more clearly or louder through air conduction, then that will show that their hearing is normal. If for example, Aaron, when I was conducting the Weber's test, if he heard the stimulus louder in the right ear, that could be signs of a conductive hearing loss. And if I followed up with the Rennie's test, and when I placed the stem of the tuning fork on the mastoid bone behind the ear, if that was louder than the air conduction, then that would be confirming that Aaron would have conductive hearing loss in the right ear. So the next component of the exam will be the nose exam. Using the otoscope, you can use a new tip if you would like, but you can use the same tip for the same patient. And so for this one, you'll have the patient tilt their head back just slightly, and then push up on the nose. with your left hand. And then as you're looking in the nose, make sure that you're looking through the window to ensure that you know where you are going and you're not making anything uncomfortable for the patient. And with this, you want to note any redness. That could be signs of an infection, or if there's any discharge that were red or yellow, that would also be signs of an infection or potentially allergies. But in Aaron's case, everything is looking normal. The last part of the exam is the throat exam, or mouth and throat. So with this one, you will use a tongue depressor to push down on the tongue. So for this, have them open their mouth and instruct the patient to say ah, and when doing that, that will elevate it'll give you a better view of the soft palate, so you can see if there's any abnormalities in there. So when examining the patient's mouth, you want to notice any abnormalities with the hard palate or the soft palate. If the uvula is deviated to one side, that could be signs of any kind of trauma with one of the cranial nerves. And then also looking at the tonsils, if there are any yellow or white patches, that could be signs of strep throat or potentially tonsillitis. And this concludes my general medical exam video.